You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, vein disease. What you need to know, specifically, vein disease of the legs. With us, we have an expert on the topic, Dr. Leslie Giesemann. Dr. Giesemann, welcome to the program.
Thank you very much.
Now, before we get into today's topic, we should tell us a little bit about your practice here in San Diego. I mean, who's your typical patient, and what are the different services you offer?
Well, my practice actually is a combination practice. So I have both general surgery that I do as well as my private practice where I see a lot of patients that come in with leg swelling and leg discomfort.
Okay. Now, your background and training, you are double board certified
Yes.
in critical care
Yes.
and also general surgery. Now, this critical care, is that like emergency room stuff?
Well, it's kind of like emergency room. I do trauma surgery. So trauma means that I would go to the emergency room if there's a patient that's critically injured or ill. But the ICU is actually taking care of the patients in the ICU unit, the intensive care unit.
Okay.
Yeah.
So, but if somebody were in a bad accident, are you the person that's there on hand to do the surgery then,
Yes.
or taking care of them after the fact?
Yes,
Or both?
and both actually.
Okay. Now, I have a friend,
Mhm.
Dr. Greenberg in Palm Springs. He
Mhm.
says the smartest doctors
Mhm.
are the ones that have this type, the trauma surgeons, because you have to know everything, he says.
Well, we have to know a lot. I feel like I know everything, but I may not.
You're too humble to
Yeah.
admit that. So we invite you on the program
Mhm.
to talk about vein disease. First of
Right.
all, what is it? What are the symptoms? And how big of a problem is it?
It's a huge problem. There are at least 25 million people that have it. Some of those don't get diagnosed. Some of them go to their doctor with vague complaints. And that's generally what happens is they go with vague complaints and their doctors tell them that it's a normal sign of aging, that it's something that women have or because of their lifestyle that people have. And so I'm here to let people know that this is something that they can actually get treated.
So what are the specific symptoms? Are they always visible, like big bulgy veins?
No,
The
and
obvious?
that's one of the problems, that when you have big bulgy veins, then obviously you have vein disease. But when patients have swelling, if they have discomfort at night, that's one of the problems that
Discomfort like what? Describe
like
that discomfort.
cramping type of pain.
Okay.
So if they have cramping at night, if they have kind of a restless leg type syndrome,
Mm-hmm.
then that can be a symptom of vein disease.
And what's going on that's making, give us the, I guess,
the-
easy to understand version.
Yeah, the physiology.
Yeah, I mean, what's happening?
Well,
What's
a lot of times what happens is the veins carry back the waste products from the muscles. And so when those waste products don't get carried back efficiently, then they hang out around the muscles. So when they're hanging out around the muscles, that's when you get the cramping, you get the lactic acid that builds up. And that's why a lot of these patients have their symptomatology.
Okay, so what do you do? Okay, so they go to you,
Right.
and how do you determine? I guess you're the person that's doing the diagnosis.
Correct.
So take me through that process.
Okay, so a typical patient will come to me with a complaint. It may be a vague complaint. They may have swelling of the legs. They may have varicose veins that you can actually see. So what I do is I actually treat those patients with physical examination. I measure their legs. We send them for an ultrasound, or we do the ultrasound in our office, and I review all of their medical history, because I tell my patients, you're not just legs walking in. They're connected to a person. So I need to know about that person. And we set up a program that's actually structured around that person so that we can determine what the etiology is, what the cause of their symptoms are, and so that we can make a treatment plan for them.
So if it is determined that they have, so they have some varicose veins, or veins that are starting to come to the surface, or maybe no visible veins at all, but they have tired legs, heavy legs, some of the symptoms you discussed, you give them a diagnosis of vein disease.
Correct.
Okay,
Correct.
then what?
Then we send them for an ultrasound, or we're getting the capacity to do that in our office as well. So they would come to me, I would give them that diagnosis, and that's a working diagnosis. So then they have their ultrasound done, and when the ultrasound is done, if it shows that the veins aren't working the way they should, then we can recommend that they have a treatment for that.
Okay, and usually it's covered by insurance, if they have insurance.
Yes, but you actually have to have these steps done prior to your insurance covering them.
Okay, so what are the treatment options then? I mean, what are they actually doing?
There are a lot of different treatment options. The old way of doing it was vein stripping.
Okay.
So patients would go to the operating room and have the veins removed. But now there are less invasive ways where you can actually inject with an agent that causes the veins to close. You can also inject and have the larger veins close, which usually the larger veins are the start of the problem. The smaller veins that you see more superficially are the ones that are more symptomatic.
Okay, so who should be doing this treatment then? Should it be an interventional radiologist, a cardiologist? Who does this type of work?
Well, there are a lot of different doctors that will do this type of work. There are phlebologists that have been trained. There are interventional cardiologists. There are interventional radiologists that do it, as well as surgeons. So there are multiple specialists that will do this type of procedure.
Okay, so would you say that there's a lot, we talked in the green room, there's maybe tens of thousands of people just here in San Diego that are suffering that don't have to be?
Yes, yes, definitely.
And what, they do nothing? Why? Because they can't see it?
Well, one of the things is that the symptoms may be so vague that they just attribute them to something else. So when they go to their doctor, they don't bring up that information. Or when they bring the information up to their physician, they may say, oh, well, that's something that we see as you age, or women get these all the time. So there are different excuses that they may receive, and they figure there's nothing that can be done.
Now, are the treatments painful?
There's anesthesia that's used if it's one of the larger treatments. The sclerotherapy can be painful because you're injecting and you're putting an agent within the vessels. So it can be minimally painful.
Now, there are laser treatments,
There are laser treatments as well that can be done.
So what is the best way to go?
Well,
like what's hot right now?
Well, actually, laser and then the radiofrequency ablation.
Okay.
I personally prefer radiofrequency ablation, but
hurts less?
I've been told it hurts less. You know, I haven't had it done, but I've been told it hurts less, and that it's more controllable. But there are two different schools of thought.
So so someone's legs. So I understand this correctly. So they're putting like some sort of little cannula or something.
They put a catheter.
In there.
Right. The catheter goes in.
Ultrasound.
They actually follow it with an ultrasound.
Okay.
So the catheter goes into the vein, and the person who's doing the ultrasound can actually follow that catheter.
And then the radio frequency
right.
is hot.
Right. And that actually causes the vein to collapse because you're actually pushing with the ultrasound machine at the same time.
But don't you need those veins?
You don't. If they're not working correctly, there's nothing you can do with them. And I get that question a lot because people hear that they take the saphenous vein to use it for bypass surgery. And if they're not working correctly, you don't want to put a dysfunctional vein in for a bypass because you can actually have it blow out. You can have problems with that.
Does your body produce another vein?
Your body produces more veins. Sometimes when you do sclerotherapy, you can actually get additional veins that can come. And that's one of the things that can happen. That's called matting. That's the medical term for it.
Okay. What are your frustrations in this on this topic?
My
misconceptions.
My frustrations are that people are not getting treated. And that's the main thing. That people go with symptoms and they kind of get poo-pooed. And that's the reason why I started my focus on these patients. And with my focus, I actually evaluate the patient. We put them on a regimen. We get and enlist their help in the treatment so that they're able to maintain their results, as opposed to here's what you need to do, or we do a spot treatment and then send you on your way. So we actually give them the tools so that they can maintain the results that they have.
So normally people go to their primary care physician and say, you know, my legs are tired, right? Yeah. And then sometimes when you said they're poo-pooed, it's like, hey, it's part of aging. You're getting older. You're 75 years old now, which is young today.
Yeah, yeah.
So a lot of these people have a vein problem, like a circulation problem.
Right. Many times they can have a vein problem. We won't know for sure until an ultrasound is done. But the part that really frustrates me is when they have an ultrasound and there is no vein problem, but they still have leg swelling, they still have the cramping. And many times that's because the fluid is there and nobody's actually treating that fluid, because once you determine that there's no vein problem, then a lot of the vein doctors will say, well, there's nothing for me to do. And then that person still has that same complaint. And so I treat a lot of these patients with the program that I've developed, and we actually get good results.
So why don't primary care physicians know this?
I think they know a little bit of it, but today they see so many different things. To sit and spend the time that we take takes a long time.
So if you hear complaints all day long, they're talking about this and that, their arm, and then they say, oh, and also I have tired legs.
Right.
It gets missed, you think.
Exactly. I think that's what happens a lot of times. Or they get treated with, oh, you have extra fluid, so let's give you some diuretic, which is a water pill. so that they can pee off the extra fluid, but then they continue to have the extra fluid. And I get that complaint a lot, that patients are taking a lot of medications to get rid of that extra fluid, but they still have it. And so we found ways that balancing diet, exercise, massage, therapies, that we can actually get rid of that extra fluid so their complaints are pretty much down to
So some people are off medications, and because I guess they have more energy now, their legs feel better, they're exercising, and everything's good.
Yeah, and we laugh at our office. We say we should do a study correlating their legs getting better and juicers, because I have so many of my older patients come in and say, I bought a juicer, because they just feel so good.
Okay, good. I want to thank you for coming on the show.
Oh, thank you very much.
So if somebody wants to find out more about what you're doing, your website?
We have a website that's in development, but we do have, we can always have someone call the office.
Okay, good.
So it's easy to find me.
Thanks. Thanks for coming on the program.
No,
You've been watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.